Hello, everyone. My name is Dr. Richard Horowitz, and I'm co-host of the Healing Lyme Summit. I'm here today with my other co-host, Mariah Hinchey. And Mariah, I'm so happy to have you here today. Today's topic is going to be what not to do when you remove a tick. And I want to be thanking you tremendously for all the 17 years of work you've done in this field, because living in Connecticut, we're certainly in the middle of an epidemic. And I want to thank you for all the work you've put into this. Let me just read a quick bio for you. Dr. Mariah Hinchey is a Connecticut-based licensed naturopathic physician, fellow of the Medical Academy of Pediatric Special Needs, or MAPS, and she specializes in the treatment of vector-borne diseases. With over 17 years of experience, she has treated thousands of patients facing chronic tick-borne diseases, gaining invaluable insights into the complexities associated with these conditions. So thank you. Why don't you tell the audience a little bit about yourself and how you got into this?
All right. Well, hi, everyone. Good to see you. Good to see you, Dr. Horowitz. And again, honored to be co-hosting this event with you. Well, I'm a naturopathic doctor who was trained to find the underlying cause, and I practice here in Connecticut. Naturopathic medicine in my area, I'm in a very rural part of Connecticut, and it's not something that most people, just seek out. I'm kind of one of those doctors that is like a last resort. They've been to a bazillion other doctors, no one else can figure out what's wrong. So go see Dr. Hinchey because, I had the reputation for being able to figure out what was going on with people. So long story short, it's almost impossible to be a doctor that focuses on and finds the underlying root cause. If you don't know about tick-borne diseases and vector-borne diseases. So I never wanted to specialize in treating this. And I joke and say that I was forced to, and, to make things even more serendipitous or whatever, I ended up with all of these things myself. And thank God I did, because if I wasn't already Lyme literate, I don't know where I would have ended up. So in a very long term course of events, I now specialize solely in treating complex chronic illness, vector-borne diseases for both adults and children.
No, that's great. And by the way, for those of you who don't know about naturopathic physicians, the real role that naturopaths play, at least from what I've seen in working with them, is that they really understand the terrain of the body and the underlying biochemistry of how things work. It's not just a question of naming a disease and throwing drugs at it, which is sometimes what doctors do in medicine. The real role of the naturopath is to really look at the body, mind, spirit, emotions, like all of the factors, underlying biochemical processes, and the terrain of the body, how the body responds. So I'm glad you're there and available for people in Connecticut, and that you've had this much experience. So great. So let's dive in. What should you do if you get bit by a tick? So I'm going to give you some multiple choice questions of.
Oh no, you didn't tell me there was a quiz.
So if you get bit by a tick, answer the following questions. A, you should run around your living room screaming, "Oh my God, I got bit by a tick." B, I don't know what to do. I'm thinking put Vaseline, gasoline, or a match on it to be able to remove the tick, which unfortunately some people do. C, call my healthcare provider immediately for advice. Or D, do nothing because, the ticks are benign. They don't really carry anything important. Which of the following would you say someone should be doing?
Why isn't there a none of the above answer?
Yes, none of the above would be the right answer, although call your healthcare practitioner is certainly something you should be doing, yes. So
I thought that one ended up with the demanding the IV antibiotics. Sorry.
Yeah, no, it's quite clear. So tell everyone how. Obviously, we're all getting tick bites, right? I mean, we're all living at this point in an epidemic of tick-borne diseases. Tell people, how do you properly remove the tick? What's the first thing you should be doing?
Okay. So in all seriousness, the first thing that you should not do is put anything on the tick to agitate it or to suffocate it or anything you can dream up to encourage it to pull its head out itself. So what happens is most of these microbes are actually in the salivary glands of the tick. And when a tick naturally withdraws its head by itself, it actually regurgitates its contents into the host or the person who has the tick bite. So we definitely don't want to do anything like that. What you want to do is you want to get a pair of fine tip tweezers or flat tipped, and you want to go down as close to the skin as absolutely possible. And you want to firmly grab onto like the neck, or if you can reach the head, if it's not completely buried in there, the head of the tick. But basically you want to get as far down on the tick as possible. And then you want to pull with a steady force, and see how my skin is kind of tenting up. You'll actually see this. And you just want to hold steady pressure. And I tell my patients, start counting. Usually somewhere between when you get to 60 and maybe like 120, the tick will just let go. You don't want to flip it over. You don't want to twirl it. You just want to pull straight with steady force until the tick lets go. Then it's important to clean the area. Either soap and water, you can use rubbing alcohol, you can use hydrogen peroxide, but you want to clean the area. And then I typically will have patients make up a bentonite clay and Andrographis mixture. I like Andrographis because it's directly anti-spirochetal. And then put that on there, and this will have like some drawing action. If you don't have bentonite clay, you could do baking soda and just try to draw back up any of the saliva containing the microbes that you can. I then instruct patients to put Andrographis, if they have it, soaked in a cotton ball with either a Band-Aid or tape on top of the bite, and change that regularly, because the antimicrobial actions, you can get some of that transdermal penetration. Also, you could use like, a triple antibiotic ointment or anything that you can find, to put on the bite to try to have some sort of transdermal saturation. So then beyond that, you should take your tick, don't do anything to it, just put it in a plastic bag, a Ziploc. And then I advise going to tickreport.com. So to me, they have been the most reliable, and they have the quickest turnaround time, and they test for the most pathogens. They have various panels. I suggest that you go all out and do the $200 panel that tests for all of the different microbes. And that way, you know what you are dealing with. Because if you end up symptomatic, and we're going to get into this, there's such an overlap of symptoms in the various microbes, between like Babesia, Bartonella, Anaplasma, even Powassan virus and Lyme disease. They all have very similar symptoms, and really they're not all treated with the same pharmaceutical antibiotics. So it's important to know what organism you're dealing with so that you know what the proper intervention is. So that is why I think tick testing is so important. And with tickreport.com, you will get the results back usually within 48 to 72 hours. And it's my understanding that we have about a 4-day window is the best window to get onto pharmaceutical antibiotics or even herbal antibiotics to be able to prevent this infection. And, I think we all know that are here that it is way better to prevent than try to deal with a chronic infection.
No, that's great. You brought us some important points, and I just want to ask you about these because I've not used Tick Report. I've used Ticknology in Colorado, and they're also an excellent company. So that's a great resource for people to know. Tickreport.com. I wrote that down myself so I could, use that. You also mentioned something important about the salivary glands and the tick, some of these tick-borne infections being in there. We know that they exist in the gut, right, of the tick, but it is true that some of these ticks have partially fed, right, before they bite people. And, there's this idea sometimes in people that the tick has to be on for a minimum, right, of 24, 36, 48 hours before it transmits. So the idea, and you mentioned this, that it's in the salivary glands would mean you can have a much more likely, right, exposure to a tick-borne infection if it's already in the salivary glands. And that's part of the reason. Also, you want to be careful when you remove it, right? You squeeze the body, right? You're pushing those organisms into the skin. So that's really great information. So how should you take antibiotics or supplements? I mean, you mentioned that andrographis, and by the way, I had not this. I'm learning from you, by the way, today because this is not something I've done specifically using andrographis. Is there research that's backing this up? I mean, we use andrographis sometimes for colds and flus and other things. I've not used it topically. Was this something that they were teaching you in school that you got from the naturopathic training?
No, actually. So oddly enough, in school, like, in our training, I learned nothing more than, you gotta, the kids were playing in the grass and they had an EM rash and some joint pain and they took 21 days of doxycycline and all was well. I learned in clinic when I had a patient that had chronic Lyme disease that what we learned just wasn't true. But I'll save that story for another time. I actually learned about Andrographis from master herbalist Stephen Buhner,
Mm.
who dedicated, his entire life and career to studying mostly, tick-borne disease. Yes, this is something that I actually learned from him.
Right. And the beauty about Stephen Booner is he has huge amounts of scientific references backing his herbs, right? I mean, we have also used them, so that's great. So when should you take an antibiotic or supplements for tick bite? How do you decide when to do it?
Okay, so let's just start with antibiotics. I think it's a little bit more of a shorter conversation. So, you know, I don't recommend the use, and I think a lot of physicians don't recommend the use of antibiotics unnecessarily, right? And so, especially if we're talking about with Lyme disease, for example, and we're talking about the need to typically use doxycycline and use it for, from what I read and in my opinion, 4 to 6 weeks to be able to deal with an acute infection. That's a pretty long-term dose in an acute situation if you don't, if, for example, the tick is clean, right? So then we have a study or two that was done a long time ago that I'm not going to get into the reasons why the study was not good, but basically it was on taking 1 dose of doxycycline at the time of a tick bite and its ability to prevent the Lyme disease infection. And so a lot of doctors in my area are still doing this. I mean, as recently as within the past 2 months, I've had a patient come in with that as the treatment. I want to be clear, that does not work. It is not effective. Do not settle for that if that is what your doctor or the walk-in clinic that you goes to or that you go to wants to handle this, because it simply doesn't work. But I'll spare getting into the details. So you're caught between this decision of, do I go on a longer course of antibiotics or do I do nothing? And again, I said, this disease is much easier to treat acutely than it is chronically. So again, I'm going to go back to, if we can get the tick tested and we know what we're dealing with and we use a company that's going to get us those results within 48 to 72 hours, theoretically, if you have overnighted that tick in a FedEx package, you can get within, that crucial window to get on the appropriate treatment. So how I typically handle it is I will start with astragalus and echinacea to boost the immune system's response to these organisms, okay? Then when the tick, so basically I'm going to digress. I want to talk a little bit, and I get very, very passionate about the pathophysiology of this infection, because I think if we can just understand how this infection moves into the body and what it does, it just makes sense how to intervene. So let's just focus on Lyme. So the spirochete has a flagella, which is like this little tail on it. And so it has this protein called the flagellin. And the flagellin, once it gets into your body and attaches to like a blood vessel, stimulates an inflammatory chemical called nuclear factor kappa beta. Okay, nuclear factor kappa beta is going to kick off this inflammatory cytokine cascade that ultimately breaks down our bodies, allows this infection to spread, and makes us hospitable to it, and makes our immune system, like in a chronic phase, not be able to see it and fight it correctly. So we have herbs that actually have been studied and shown to inhibit nuclear factor kappa beta. And those are astragalus, cordyceps, Japanese knotweed, ashwagandha, houtunia, Chinese skullcap. So we have this big sort of toolbox of herbs that can help to shut down that inflammatory cytokine. Next, we have mitogen activated protein kinases, or MAPKs, that stimulate other inflammatory chemicals like interleukin 8, interleukin 1 beta, that further help this infection get deeper into the body. And we can inhibit the mitogen activated protein kinases using Japanese knotweed and Chinese skullcap. Additionally, this organism, these spirochetes, use various enzymes to break down the connective tissue, our extracellular matrix, our collagen, our joints, and gain further entry into the body. And so they use these enzymes called hyaluronidase, agrokinase, and collagenase. And we can actually inhibit these enzymes, again, using Japanese knotweed, Chinese cat's claw, as well as echinacea and ashwagandha. So, this is like a multifactorial or factorial approach to trying to contain the infection and slow the spread by managing the immune response, the inflammation response, as well as stopping this infection from degrading our collagen and moving deeper. So that's sort of my favorite intervention, is to get on those herbs. And really, we could boil that down to ashwagandha, Japanese knotweed, and skullcap. The beauty of these herbs is that they have far-reaching benefits. They work synergistically, and everything that I just said can actually be inhibited by those 3 herbs. So I like to always start with those 3 herbs plus astragalus. And to me, that gives some protection, and from a theoretical standpoint, while we're waiting to get those results back. And then you can either add the appropriate pharmaceutical antibiotic or anti-parasitic or antiviral if necessary, like if it's Powassan virus, in addition to using these herbs.
That's great. So, just to sum up a little bit for people. So when you're seeing a tick bite for people, and again, if the tick is just on for a very short period of time and easy to remove, you don't necessarily, have to give them anything if it's a very, very short course. But the problem is that some of these infections, like Powassan virus, which you mentioned, can be transmitted within 15 minutes, and rickettsia, Rocky Mountain fever, within 10 minutes, and Borrelia hermsii, relapsing fever, within 5 minutes. So the recent tick prevention is so important. And I think you're discussing these herbs is that even if the tick is not on for a long time, there's still a potential likelihood you may be able to, to get these. So you're using these herbs in people before they get ill, before they get symptoms. You're using this, for example, they get a tick bite, you're putting them on these herbs. And by the way, some of these herbs we also know are good for babesia, They've been talking about Chinese skullcap, Japanese knotweed, also have some effects with this with babesia. So I'm clear you're using these herbs in a sense preventatively to help the immune system, blocking NF-kappa B for the immune response if they don't have active symptoms. Because if they do, if they were to get fever, sweats, chills, muscle aches, joint aches, you would then consider at that point, would that be a point you would consider using antibiotics?
Oh, absolutely. Yes. So I only got as far as this is what I would do as soon as I found the tick. And then, of course, getting the tick results back and then, using that to guide you. But yes, we're going to get into what symptoms to look out for. But yeah, if there were any symptoms, I would call your physician immediately. And to be honest, I would call your physician ahead of time, tell them what happened. And, depending on your relationship with your physician and what day of the week it is, you might have antibiotics called in so that, God forbid, you're symptomatic on a Saturday and can't get a hold of your physician. You might have that script there already.
Right. And the symptoms specifically that people will be looking for, what would be the most important symptoms people should look for after a tick bite?
So I would say, the most dangerous, around where I am at least, would be anaplasma. And so you're looking for a really high fever, a severe headache, neck pain. I would say with any of these infections, the biggest thing that, we're kind of looking out for would be like a meningitis or encephalitis sort of response. So, I would say as far as like the severity of what's going on, having headaches, head pain, high fever, things like that. But I mean, the symptoms can be mild in people, and they can also be very severe, and they can range from, having fevers, sweats, chills, headaches, muscle pain, joint pain, fatigue, malaise, nausea, vomiting, right? Like this, a lot of these will also affect the GI tract. And so oftentimes people just think they have the flu, even with a high fever and all of these other symptoms, people honestly will think that they've had the flu. And I can't tell you how many patients actually I've had end up in the hospital and just been told, like, this is like going through their history, like, oh, I had this weird mystery virus. They never figured out what it was, but I had encephalitis and I've never been right since,
Right.
So there's this.
Yeah, these are very, very important points you're bringing up. And I will tell you, I mean, because you can get, of course, sore throats, right, from getting a tick bite with Lyme that you think needs, it's streptococcus, you need something for it. But the nausea, vomiting, diarrhea, like talking about the GI symptoms, it's an excellent point for people because almost all of these tick-borne co-infections can cause these kind of GI symptoms. And if you're not aware of this, right, you might say, oh, this is a virus. So the most accurate time for testing yourself. So people get a bite, they've sent off the tick, and now they've gotten the report back. But let's say they want to test themselves. They go to their doctor and they want to get some blood tests. So what kind of blood tests do you recommend? What's the kind of time frame you think that people should be testing themselves to see if they have it? And what are the negatives, of course? What are the problems with the testing?
Right. So I'll start by saying like minimal testing, should be a complete blood cell count and a metabolic panel. So, we can look at the immune system's response, looking at the white blood cells, also looking at neutrophils, lymphocytes, et cetera. We can look at platelets. We can look at liver function tests because you might see an initial increase in white blood cells or decrease, and you might see elevated liver enzymes, and you're going to see these changes way before you're going to see any sort of antibody response, right? Or Lyme testing that's going to come back accurate. So there's two types of antibodies that are looked at, IgMs, which are kind of like our first line of attack, and then IgGs, which are the ones that come in later. IgMs typically take about 3 to 4 weeks to get them to the level that a standard laboratory is going to test you, test in the positive range for. IgGs are more like 4 or 5 weeks. So whether you go to a standard lab or even a specialty lab, if you're going to have your immunoglobulins checked for these infections, there is a super high rate of false negatives. And this is what I see happen a lot to patients. They say, well, my doctor tested me. And I'm like, when? Oh, like 3, 4, 5 days after. And it's like, well, of course you were negative. Your immune system isn't responding in the level that's detectable. So we have to look at these other things. It can take a little bit longer, but you can see something called an ESR or a SED rate go up. You can see C-reactive protein go up. You can see high sensitivity C-reactive protein go up. So these are like some other tests that you would be able to see way before an antibody response.
Great. So you brought us something extremely important that I'm going to highlight for the listeners, that the antibodies are not going to form early on. And the reason you need to look at the white cell counts, the platelet counts, and the liver functions, the ones you mentioned, is that if someone has a low white cell count, as you mentioned, called leukopenia in medicine, or low platelet counts, thrombocytopenia, or elevated liver functions, any one of these, or two together, or all three, are indicative of multiple tick-borne infections that have kind of gotten into your system. Ehrlichia, anaplasma, Rocky Mountain spotted fever, Q fever, Borrelia miyamotoi disease, heartland virus, bourbon. All of these organisms from ticks can cause these low white cell counts, platelets, elevated liver functions before the antibodies are formed. So if you see that, that is an immediate reason to go on doxycycline, right? So it's an excellent point for people. In fact, when I was at HHS working as co-chair of the other tick-borne committee, one of the doctors there from the CDC who deals with Rocky Mountain spotted fever, and you probably know, they just had outbreaks in Southern California where people died of it. You will not see the antibodies early. You do not wait to start doxycycline if you start getting symptoms with these low white cell counts, low platelet, elevated liver, because you'll die. If you don't get the doxy in between 6 to 7 days, you can have limbs amputated and you could die from the infection. So excellent point. Very, very important. That's like a super important take-home message for people. And regarding the doxy, and I don't know in Connecticut, are you able to prescribe or you cannot in Connecticut as a naturopath? You have to use
No,
doctors.
so naturopathic doctors have literally no prescriptive authority in the state of Connecticut. We have been fighting for it for years.
Yeah, it's a shame because someone like you could have given someone doxy early on, and we don't know. So it's a great point. All right, so the time for testing yourself, as you said, can be weeks before the IgM, and I would also point out the IgM antibody is also seen in late Lyme, and this is where doctors sometimes get kind of confused because when Borrelia burgdorferi Lyme invades your lymph nodes, it gets rid of the B cells, the antibody producing cells for IgG, which is the long term, and it leaves the IgM. So a lot of times people go to doctors, I'm sure you've seen this, the IgM is positive and they'll tell people it's a false positive, but it's both early and late, right? So you expect actually to see the IgM in late Lyme. In our studies, it was about 45% of our patients were CDC IgM positive. Are you seeing that also in your practice?
All the time.
Yeah.
And I mean, I don't mean to sound snarky, but it's like that point of contention where the doctors, they glum on to that and they're like, no, because also that, they might even say, okay, well, this is a new case of Lyme then because you have IgMs. So, Dr. Hinchey is telling you that all of these symptoms that you've been complaining for like 3 to 5 years are Lyme, but it can't be because this is showing that you have a new infection. I'm like, no, it's just showing that the infection is doing what it does and, changing its shape for the simplistic way to put it, and just causing the immune system to, to react to it.
Right. And going back to the point, you didn't want to go into the details, but I will just briefly of why one dose of doxycycline does not work. Is the real problem with that is when they did the study, there was no good long-term follow-up, and they were looking at EM rashes, right, which you and I were discussing before, which is, the hallmark symptom, but not everyone gets the rash. Right. In our studies, it was between 10 to 20%. Some of the studies, it's 40 to 50. You'll see the CDC sometimes report 70 to 80%, which is not really, in my opinion, what's really out there these days. And half the time they look like bullseyes, half the time they're solid red spreading rashes or, maculopapular if it's Borrelia mayonnae from the Midwest. So, excellent point. That one dose doxy, I want to bring that up again. It was never validated. Right, in that study. And you should be asking, which you had highlighted before, you should be asking for your doctor for at least several weeks of doxycycline, right? You need at least 7 to 10 days. If you've got Ehrlichia, Anaplasma, Rocky Mountain spotted fever, it's a minimum of 7 to 10 days to be able to clear that infection. Mm. Yeah. So very good points. Prophylaxis before a tick bite. What do you suggest to your patients? You're in Connecticut, very high endemic area. What do you suggest to people to not get bites?
Okay, to not get bites. Well, I would say number one, and I don't think this is what you're asking, but I'm going to start here. Tick checks, tick checks, tick checks, right? If you can get it while it's crawling on you, you can stop it from biting you, right? So I have a son, he's 7, the poor thing, he's never gotten to go to bed once or come in from being outside without having the complete strip down. I mean, even from being like 6 months old, So I just cannot emphasize the importance of checking yourself and your children and your pets because they will bring them into the house for ticks. So that to me is number one, tick checks. Number two, I really so I have a huge family of hunters and I love the tick shield clothing. So I had seen a study, God, way back that showed that something like it was almost 80% of ticks when they get onto you below your knees. And so if you have these socks that have been treated on, you're going to catch most of them there. Obviously, that's not always true, but for a majority of the time. Obviously you can use cedar oil and there are a ton of different essential oil sprays out there. You can put permethrin around the soles of your shoes. There are a ton of different things that you can do to put on your clothing. You just want to be very careful, again, depending on what you're using, because it is a neurotoxin, and so you need to be careful that you're not getting it, especially with your children. So I would say checking for ticks, treating your clothing. Obviously, if we're talking about like in your yard, in your garden, spraying your property, keeping your property cleared, keeping leaf litter cleaned up, keeping as much sun exposure on your yard as possible, because ticks hate dry, direct sunlight. It dries them out. Ticks love moist, cool, warm areas. It's their favorite habitat.
Great. So again, just to sum up, you like permethrin, right, for the treated clothing. But again, if you're going to use it yourself, you take it outside and spray the clothes. Do not get it on you, right, because it is a toxic substance. I also like picaridin. I mean, I found that 20% picaridin generally, I mean, I've looked at the safety studies. I mean, these are chemicals, of course, but I think the risk benefit. I use it personally when I go outside and I'm in my yard, because we're living in an area. Although New York Tick Control, which is also Connecticut Tick Control in New Jersey with Rich and Dave Whitman, they're an excellent company. They come twice a year, by the way. We have a little over 4 acres. I have 50 bait boxes around my property, where they've got, oats in there for the mice to go on, and it's killing them with the permethrin. And we put an electric fence for my dog Molly, because she liked to play with the fox, and would go up the hill where the fox was. The fox grew up, by the way, with Molly, and they would run around the yard together. One day, my dog was outside and the fox came, and she was on a long lead, and she came on both paws, like coming slowly, rolled over. My wife and I looked at this and then pulled on the cord from Molly and went, "I'd like to play with your dog." And we looked at each other and went, "The fox is like communicating. She wants." So Molly thought, "Oh, how much fun." We eventually ended up getting, of course, tick prevention for her, Simparica Trio. Some people use Frontline, but you're right about the pets. You got to be very careful in this area. And the lemon eucalyptus oil, I mean, you mentioned that with the essential oils. It's a very good one. It's actually been well studied. I don't personally prescribe DEET. You were talking about it, the neurotoxic stuff. I think for hunters deep in the woods, if you want to use 20 or 25% on a rare occasion and you're older, because the neurotoxicity was mainly in kids with seizures, right? But I will point out in pregnancy, and this is maybe something, I don't know if you've used it or not, but Avon Skin So Softs makes one called IR3535. It's an amino acid base. They used it in Europe for about 40 years. Have you had any experience? Because I don't use it often, but if I have a pregnant woman, I'm always thinking IR3535 because it's naturally based, and they've got studies in Europe on pregnancy.
So we used that a long time ago. It was my grandmother's favorite thing for keeping mosquitoes away. But no, I honestly forgot about Skin So Soft. I haven't thought about that in
Yeah,
years.
I don't tend to use it as much, because when I put it on myself, the mosquitoes love me. I put out a lot of heat, carbon dioxide. So for me, I've tested 5%, 10% picaridin. 20% is like the only thing for me, keeps the mosquitoes away. Fortunately, we haven't found ticks in a while, but yeah, you've got to pay a lot of attention. So the tick testing companies, you went through this and the time to transmission. So we talked about symptoms before, and I want to talk a little bit about, you mentioned it's very, very important about these great imitator things. We had a guy in our area, I can mention the name because he passed and his mom has, told me about this. His name was Joseph Aloni, and he went to a local doctor here in Dutchess County with a sore throat after going to Rhode Island. He had some swollen lymph nodes and he had some diarrhea and stuff. And you brought this up, and they said it's a virus. Come back, in a couple of weeks. He came back a few days later with a sore throat, and they said, "All right, we'll check you for Lyme." They did an ELISA, right? The test was negative, and he died 3 weeks later from Lyme carditis. He had an infection of his heart. And you brought up a really, really important point about these symptoms, that the ones that docs may not be looking for in the springtime or summer or fall is like sore throats and swollen glands, or GI symptoms with nausea, vomiting, diarrhea. Very, very important to be able to look for these type of things, because if you've got like the low white cell counts, low platelets, elevated liver with that, automatically, right, you've got to be able to treat these people. So I just want to point out those are really, really important symptoms you brought up after a tick bite. And for me, fortunately, I see mostly late Lyme at this point. I don't see a lot of early Lyme. But I will tell you, in the last couple of years, with the climate change, with the ticks exploding, I mean, we have people calling all the time regarding tick prevention and regarding, courses of doxycycline. I'm sure you're probably seeing the same thing at this point.
Yeah, I am. And I mean, so I'm in Connecticut. We are or I guess the beginning of January. And I mean, there are still ticks out right now, like
Right.
literally right now. I have a picture of a tick crawling on snow. So, I mean, it's just, people think, oh, summer. And it's like, no, it's year round. I don't care where you are. It's year round.
Yeah. Um, can we discuss for a second the use of doxy in pregnancy in kids? Because this was also one of the things that was brought up by the Rickettsia researcher from the CDC, and I was there. Can you talk a little bit about using doxycycline in pregnancy and in children? Because there was a lot of controversy early on about tetracyclines and teeth staining. Do you recommend it at this point? Pros and cons?
So, I mean, I would say I looked. Even the CDC is saying that a short course of doxycycline is safe in children and does not cause the teeth staining. So, that was based off of older generation tetracyclines. So you typically aren't going to see that now. What I will say about pregnancy is that from what I could see, it still isn't recommended. There hasn't been any quote unquote studies that I could find, because they don't do studies on pregnant women. And, typically they are recommending amoxicillin and Ceftin. But again, when I say they, when we're talking about the CDC and kind of like, we're not talking about Lyme literate bodies of people here. So, honestly, I'm going to defer back to you as far as using doxycycline in pregnant women.
I fortunately have not oftentimes had to use it, but at least what I got, and the only reason, by the way, I learned this is when I was co-chair of the other tick-borne infections and subcommittee. One of the researchers from the CDC, we discussed this in detail, and kids had died from Rocky Mountain spotted fever in the United States, or Ehrlichia anaplasma, because the pediatricians below age 8 would not give them a tetracycline. And you brought up appropriately, it's the older tetracyclines like tetracycline HCl that causes the teeth staining. Doxycycline, and this is specifically doxy, does not cause teeth staining in short amounts in kids. When I spoke to this particular researcher, he said that a short course of doxy in pregnancy actually was okay, for the same reasons that we're not expecting teeth staining. We're not talking long courses. We're talking like, and you talked about this, you get a tick bite, you send it out to either Ticknology or tickreport.com. You get back that it's containing Ehrlichia anaplasma, Rickettsia, Rocky Mountain spotted fever, Borrelia miyamotoi, Lyme disease. You've got a risk of that being transmitted in pregnancy and to the child. In those circumstances, amoxicillin and Ceftin is not going to hit those organisms. You need a tetracycline like doxy. So the only reason I learned it is I got it directly, in the sense from the CDC directly when I was on the subcommittee. So I've not had to do it, by the way, often. I think only once in my entire clinical career. Thank God. But we do use antibiotics in pregnancy to prevent transmission. And again, specifically, it's Ceftin, it's penicillin, cephalosporins, right, that are primarily used. So I think that's just an important point. Do you have a sense, and this, by the way, this is an unknown area, but I just want to point out, because I've never seen good literature on it. These people that get tick bites, that, most of them, 75% of them, especially if you treat it early, they do not go on to chronic Lyme. But there's always these people, right, that go on to chronic Lyme. And I just want to point out that we don't really know exactly why. We don't know if there's biofilms inside the ticks. And I don't know if you've read anything on this. This is a question even I have, whether there's biofilms initially in the ticks, in the gut or in the salivary glands, that when it's transmitted is hiding the spirochete. Maybe they fed on other animals. This is kind of an unknown question. But, I think the thing that's important here is not everybody who gets early prophylaxis is definitely, it's going to work, right? So you've got to really be careful in these type of people to watch, because once it establishes in a chronic infection, it's obviously much more difficult to treat. So I just wanted to point out, we still have a lot of unknowns, right, regarding this with these tick bites and exactly what to do. And it's also different ticks, right? We've been discussing mostly Ixodes scapularis, right, the deer tick, right? But if we deal with, for example, the Lone Star tick, right, which is now spreading right across the United States, we're dealing with tularemia, Ehrlichia, alpha-gal allergy, Rocky Mountain spotted fever, Heartland and Bourbon viruses, star eye, southern tick associated. So even in those cases, right, if you get a Lone Star tick bite, the doxy may be helpful, but not for alpha-gal, right? These people that get these red meat or alpha-gal allergies, right? This is now becoming a really big problem. I'm starting to see them in my practice. Have you also seen a couple? Have you come across it at all?
I've seen two patients with it. I want to back up for a second too. So like for our listeners that maybe don't understand what the biofilm is, it's kind of like this fancy 3D structure fort almost that the infections use to evade the immune system. And so like Dr. Horowitz was saying, like this could be a reason why, even if you're put within the right amount of time, for the right amount of weeks, right? The right antibiotic, you could still end up with chronic Lyme. And I was reading that, like, these bacteria can actually establish biofilms in the body within like 48 hours, right? So it's not like you only get biofilms with chronic tick-borne disease, right? Or chronic Lyme. This actually can happen pretty quickly. And I want to share because I think this kind of just drives it home. So I dropped my son Everett off for his little moving up ceremony for kindergarten at school. And like I said, the boy has never gone to bed without a tick check. Like I'm a crazy person when it comes to ticks. It's like one of my husband and my like points of contention, because of what I do all day. He did not have a tick on his face when I dropped him off. The little boy walks in with his little cap that he made in his little gown to go up there and like walk. And I see this teeny tiny, it was a nymph deer tick. I saw it from across the room and my husband had to hold me in my seat as I'm screaming, he doesn't have a freckle there. He doesn't have a freckle there. Okay. He did not have a freckle when I dropped him off an hour ago. We did everything I said. So luckily his school is less than a mile. I literally left as soon as the little, before the refreshment, went and got the herbs, brought him back, forced him to take them, sent the tick out. The tick tested positive for Borrelia as well as Babesia, but started him on the herbs immediately. He never had any symptoms, right? But I had to know. I waited the 4 weeks. I tested him. He tested positive for Borrelia and for Babesia, and it was Babesia duncani, which is the same Babesia that the tick had tested positive for. So he made antibodies, but he never developed symptoms.
Oh, that's fascinating.
I've since tested him and it went away. And I mean, I could go on and on about my kid for hours and I won't. But my point is like that tick was not on him for more than an hour. And it transmitted both of those organisms. And the fact that they were the organisms to the species that the tick itself tested positive for, tells me like he didn't get this from me congenitally,
No, what this brings up is what you now you were talking about this early, and this is a really important point for the listeners, is that if these tick-borne infections are in the salivary gland, and most of the time when it's been talked about, it's because the ticks have fed on another animal, partially fed, so the bugs moved from the midgut into the salivary glands, and once they bite you, they're already in the salivary glands, and they can be transmitted very quickly because you hear from most doctors, oh, it's 24, 36, 48 hours to transmit. You're proving it yourself, and we know this from the studies, that that's not the case, especially if the tick has partially fed. So that is the reason tick checks, as you said. You're a very vigilant mom, by the way. If you can spot a freckle from across the room in your kid, bravo. But you're right. And what's interesting about it, especially in the case you just, is that clearly there had been some exposure where the antibodies were forming, but obviously you got it early enough, right, with these herbs. And you never gave him any antibiotics, and yet he never had symptoms.
So not to go off on a whole big tangent, but long story short, it's the only time this has ever happened. We've probably sent a good 12 ticks to tickreport.com. FedEx lost the tick. So it took us about 10 days to get the results back. And at that point, and so two things to share. Yes, the tick was partially engorged. It said so on the result. And by the way, I went like this and the tick came out of him. It was in him. It wasn't just on him, but I mean, that's how easy it was to remove the tick. So it's
Even
like,
even engorged with it not being on for that long.
right.
Wow.
So my husband and I, and it's funny, my husband looked at me and he was like, hey, herbal queen, put your money where your mouth is. He doesn't have symptoms. He's be outside of what you claim is the window. You believe in these herbs or not? Honest to God. And I mean, this kid is like my life, you know what I mean? So it was the hardest thing to do, but we decided to go with the herbs because he wasn't having symptoms, and we were outside of the window, etc. Plus this was when, the newer studies showing, that cryptolepis has effectiveness against persister cells, and, like some other studies had come out showing like Japanese knotweed cat's claw. And by the way, like I'm almost embarrassed to say I had that poor boy on 18 herbs. I mean, I went into my office like a crazy person, and I kept him on them for an entire year.
No, once you understand how severe these tick-borne infections are, and these herbs are safe. I mean, I've certainly been using them myself for years. Risk benefit, right? Everything in medicine is risk benefit. But the thing that's interesting about your story here is normally in medicine, we think about engorgement for a tick, that the tick's got to be on for at least 48 hours, right? Before it's going to start to get engorged. And you are so vigilant that when he left in the morning, you didn't see the freckle, but by the evening, which means that
it wasn't the evening, it was an hour later. Because it was his moving up ceremony. We brought him at school to get ready. We went and did a few things, came back for this little like graduation moving up ceremony. This was not a normal school day.
So tick report within, I mean, just so I'm clear on this, because this is unusual. Even within 1 hour when you sent out this tick, it even said it was partially engorged.
The report came back partially engorged. Yeah. So I think it must have been scratched off another animal and then got onto him and then started feeding. Like, I think it was already partially engorged when it attached itself to him, which is why he got the transmission of the organism so quickly.
Yeah, great. Well, I mean, you're right. I mean, the thing is ultimately clinically, you always, you treat patients, you don't treat blood tests. I mean, that is always a rule of medicine, because I have had people come in, for example, with positive Lyme tests who have absolutely no symptoms. Now, what I will say, and sometimes in these cases, not necessarily for your son, but in an adult population, if someone comes in and I see a positive Lyme test that says there's absolutely no doubt, like even their Western blot or immunoblot, they've got the Lyme specific bands, 23, 31, 34, 39, 83, 93, and they're asymptomatic, what I usually still will tell them is, you and I need to discuss 3 to 4 weeks of doxycycline in case, God forbid, anything ever comes out later on. I want to at least be able to say medically, legally, that I treated you with 30 days of doxycycline when I saw your positive Lyme test. Fortunately, those cases don't come in very often. Most of the time, these people are symptomatic. But you bring up an interesting case of, we will occasionally see people, right, who have antibodies who are not that symptomatic. And the rule of thumb is you do treat patients, right? You don't treat blood tests, but you've got to use that clinical decision making, right, to be able to do it.
Yeah, and let me be very, very clear. This is my son. I would not so what I chose to do, the choice that my husband and I made with our son, is not my medical advice to a patient. My medical advice to a patient would be the standard of care in the sort of, Lyme literate world, which would have been 4 to 6 weeks of doxycycline for the Lyme, and, potentially atovaquone and azithromycin for the Babesia, right?
Right. Although it's a good point. And the Babesia is much more difficult to treat, especially now because these Babesia species have become resistant to atovaquone and azithromycin and clindaquinine. So even, thank God he didn't have symptoms, the malarial symptoms, air hunger, cough, day sweats, night sweats, chills, because it is a difficult infection to treat. But, kids generally, they're generally, they are healthier a lot of times when they come in. They're much more resilient. I don't have a pediatric population in general, but the few kids that I have treated, they've definitely recovered very quickly and seem to be much more resilient. Yeah.
He's no
So
longer testing positive either for either. So
right. No, that's great. Any last things that you want to talk about? From my perspective, this is a really, really important talk because the most important thing, you have to know what to do if you get a tick bite and you get a tick on you. And the fact is that sending out the tick makes absolute sense, right? Knowing that the antibodies are not accurate, knowing the low white cell count, platelets, elevated liver functions, knowing it's a broad range of symptoms. You brought up some really important points. Anything else on this you think is important to share with our listeners?
well, on a lighter note, I guess I would say don't panic, right? We get really stressed out and we panic, we're going to release a bunch of cortisol. It's going to suppress our immune system. And if there is anything there, it's going to give it a stronger foothold, right, to cause issues. So, try to stay calm. I would have someone who is knowledgeable about Lyme and Lyme literate, you know, around you, just so you have somebody there when you need them. But really tick check, tick check, tick check, prevention, prevention, prevention.
Right. And keeping in mind, the reason this prevention is so important is that things like Powassan virus, which are transmitted within 15 minutes, there is no cure for Powassan, right? So about 10% of these people get a neurological form of it where they do get a meningitis, encephalitis. There can be long-term consequences. People die, right, from Powassan. We're seeing more and more cases in the United States. They do have a vaccine for tick-borne encephalitis in Europe, which is similar, which is also, by the way, transmitted by raw unpasteurized goat milk. A little scary in Europe with that one, although I haven't heard a lot of cases of it. But the reason the tick prevention is so important is that if you get alpha-gal from a Lone Star tick, there is no cure for it. You've got to avoid these things for the rest of your life. If you get Powassan, right, there is no cure. So we do have cures, right, with doxycycline and some of these early on, but the prevention aspect, I think, is absolutely crucial so you don't get sick. And, I joke with my patients because occasionally after I've got them over Lyme with the Dapsone protocol, they've come in with tick bites and I tell them to come in person. Don't do this by telemedicine because I'd like to put my hands around your neck or give you a good spanking because you have got to be kidding me. After all the work we did to get you better, you're now not doing tick prevention in the right way. So yeah. And by the way, doctors don't have a lot of time at the end of visits, right, to discuss this, but you and I know this is kind of one of those things like, how's your blood pressure? How's your cholesterol? Are you getting enough exercise and sleep? How's your diet? And are you following tick prevention, right?
Yeah.
It's one of those things in prevention. It just needs to be part of a regular medical exam and what doctors discuss.
Yeah, I couldn't agree more. I don't understand how I could go on a whole nother tangent. I don't understand how being Lyme literate is not a requirement.
Well,
I
it may
don't
it may be at some point in the future as people realize how bad this epidemic has actually gotten. But listen, I want to thank you so much for taking the time with us today about discussing this important topic of what not to do when you get a tick bite. So this is Mariah Hinchey in Connecticut. Mariah, tell people again how they can contact you if they want more information.
Sure, you can go to tauvitality.com or call 860-228-1287.
Thank you. So thank you, everyone, for joining us again for another episode of this Dr. Torque episode of the Healing Lyme Summit. My name is Dr. Richard Horowitz with my co-host Mariah Hinchey, and we hope to see you again soon. Thank you so much for joining us today.